osteoporosis. It means it is a disease in which the bones of the body become fragile due to the weakness and destructive process inside the structure of the bones. The bones consist of two portions. Outer, which is called as cortical area. In cortical area there is a Virchow canal which consists of blood vessels and the nerve endings. While the second inner portion is called as spongy area, which is porous, consists of multiple pores, in which there are two types of cells located. Osteoblast, concerned with the construction and reconstruction, formation and building up of the new bone and the bone materials. Second is the osteoclast, which is concerned with the resorption, destruction of the bones after the age of 30 years or even more in females, 45 years in men it is beyond 60 years, because it is the disease of the aging or elderly persons. Because in youngsters or the teenage there is abundant production of the estrogen in the female, androgens in the men. These two hormones are very vital for the construction and structure and the health of the bones in the human being, because the action of these hormones enhances the and boosts up the activity and function of the osteoblasts, which are concerned with building of the material concerned with the formation of bone. So the peak bone mass or density is attained near about 30 years age. After that there is combination of the actions. Osteoclast and osteoblasts simultaneously come into the action, because certain factors favors the function of the or the health of the power of the osteoclast, that produces the resorption or the destruction process of the bone, because it is a demand or the actually the stage at which the age is the main factor. So production of osteoporosis is mostly in the females after menopause. There are also genetic factors, and then is food and nutrition deficiency of the vitamin D and calcium phosphorus, vitamin K. Similarly, there is other diseases in the body that produces secondary osteoporosis like hyperthyroidism, hyperparathyroidism, diabetes mellitus, hypertension. In addition to these, there are other factors or habits of the person, that is smoking, over drinking. And this smoking or the tobacco smoke consists of hundreds of chemicals which are injurious to the health of the human being, producing various pathologies in the lungs, kidney, brain, liver and the bones. These are the injurious chemicals which destroy the production and give a damage to the bones due to the stimulating or the aggravating factors of the osteoclast. The treatment is mostly by bisphosphonates drugs are used. In addition, calcitonin hormone therapy is also used. Then is the supplementation of the vitamin D and calcium are also provided to the patients for the strengthening of the bones. Now, how to detect the degree and extent of the osteoporosis in the bone? And that is the test which is called as DEXA scanning test. If the T-score is below -2.5, it is diagnosed as osteoporotic stage. Now next is the prevention of the osteoporosis. First is look after the aged ones, as this is the disease of the aged elderly and elder persons, because fall and the trauma, even mild to moderate, that also inflict the fractures of the bones, especially in the hips, spines, ribs and wrist joints. Diet should be healthy diet consisting of high biological protein, calcium, phosphorus, vitamin K, zinc and iron minerals. Adequate and plenty quantity of purified water is essential for the nourishing and the health of the bones and the all over the body functions of the organs. Then next is exercise. The function of exercise in the prevention of the osteoporosis is vital one and is a topmost factor. This consists of two types of exercises: aerobic exercise, weight bearing exercise. They should be regular one, at least 30 minutes daily. Should be, but this must be light one, which should not be vigorous one or heavy exercise that may damage the or produce the compression, fracture of the spines and the ribs. The habit of smoking is mostly found in the elders, so it must be quitted altogether by teaching them and explaining them the hazards and the dangerous effects of the chemicals found in the tobacco smoke. Excessive quantity of alcohol should be avoided because it also produces not only the damage to the mucosa, gastric mucosa, but also it produces damage to the bone structure. The various medicine should not be used blindly, especially corticosteroid should be used in limited and a short duration in the case of emergencies only. Proton pump inhibitors, they are widely used nowadays, but it should be considered that it also produces osteoporosis in the long run, so it should be given under the supervision of medical healthcare providers to the patients.